I'm called Ashaba. I'm a speech and language therapist by profession. What we do as speech therapists, we are experts in communication and swallowing disorders, and majorly also any children who have communication difficulties or who have delayed to speak. For example, in a case in point, children who are on the autism spectrum. Autism, in short, is a disorder or is a difficulty that someone has with socializing. That is usually the very first sign. The best solution or the best thing they can do is to start treatments or different interventions that can help this child be able to integrate into their environment. So for children who have mild to moderate signs, the signs really become limited and they start seeming like they are like other people. So you find people cannot recognize it from the word go. It could be lifetime. Autism has no cure, okay? But this is what happens when a child gets early intervention, okay? What happens is when the child is able to integrate into their society, what happens is they keep coming for monitoring and reviews. Intervention is really needed at a very, very early stage. Of course, if a child comes to me, if they have no diagnosis, first of all, I take my case history, then I do my initial assessment. Usually, the diagnosis process happens in an ideal situation. It's supposed to be a multidisciplinary team, which includes the neuropediatrician or the clinical psychologist. We can have the occupational therapist plus the speech therapist in that multidisciplinary team. So what happens in an ideal setting, they should sit on the table and assess this child and diagnose the child is on the spectrum. You know the names they usually call people who have something wrong with them. They say Kasiru, they are mad, because of, for example, the stereotypic behaviors. For example, you find a child, they are fixated or they really like something so much. For example, a piece of grass or a piece of paper, they are always tearing papers. And so someone will be like, this child is mad, but it is a fixation, okay? It's a stereotypic behavior. That has to stop. People have to try and understand these children. People have to be empathetic. You put yourself in the child's shoes and try to understand why all those behaviors are happening the way they are happening. Yeah. Of course, there are many specialists who deal with these children, but it's according to what you're able to give or what you're able to help. For example, as I've discussed, there are 3 characteristics that these children have: difficulties with communication, difficulties with social interaction, and stereotypic or repetitive behavior. So all interventions are based on those 3 difficulties they have. So for example, a speech therapist can work on communication and social interaction. Occupational therapists usually help a lot with sensory integration, okay? Because these children have different sensory seeking behaviors. So they help a lot with sensory integration, and they also sometimes work on social interaction. Speech therapists and occupational therapists usually work hand in hand to work on the feeding of the child. Then also a nutritionist can come in at some point if they are to advise on the different foodstuffs to eat. Children on the spectrum are like any other children. It's just that they are born with a different, way of living life. They are not like all of us, but it doesn't mean they are not like us, okay? So for me, I can say these children have potential and they can reach whatever, whatever potential you want them to reach as children or as adults. So anyone who has a child on the spectrum, okay, they shouldn't give up, because there is potential as long as the child gets the right help and the right treatments.